Hi, my name is Tanya. I'm a physician assistant with Miami Plastic Surgery. Today we're going to be performing a new CoolSmooth treatment on our patient Crystal. She's a previous patient of ours. She had CoolSculpting prior and was very happy with her results. The area that we're going to be treating today are the outer thighs. We're using the new CoolSmooth applicator, which was FDA-cleared for the outer thighs. The applicator looks like this. It's a flat panel applicator that we actually attach to the area. This requires no suction, which is very exciting for a lot of our patients. Sometimes the suction can be a little bit uncomfortable, and this takes that away. This one you just tend to feel an intense cold sensation, so it's very similar to putting a bag of ice on the area. That lasts about maybe 5 to 10 minutes as well. That treatment is 2 hours. It's a little bit longer since there is no suction with this applicator. And you will sit with it for 2 hours, and then when I take it off, you'll go through that same warming up process where your body has to get back to normal body temperature.
I came in to do the CoolSmooth treatment on my thighs because it's a problem area that I've always had. No matter how many squats I do, no matter how many miles I run, it's a very hard area to treat. So I had a previous treatment done on my stomach and I had amazing results, so I came back to do another problem area on my outer thighs.
So I've actually already marked Crystal's thighs. We've taken her photos and we have weighed her. So now I've got her in position and I'm ready to start placing my first applicator. So what I'm going to do is actually mark out the area here. So I've got a little template that we used. I've already put the X to mark the spots. So I'm just going to place this here and sort of trace around there so I know exactly where to place my applicator. And we're always very strategic when we do this because we want to make sure that we put it over the area where the fat protrudes the most and not over a flat portion so that we don't cause any indentations. So the next part is to actually place a foam border on the area. This prevents the applicator from sliding around while she's having her treatment. So I'm going to peel the little stickers off here and actually place it. So we're going to put one right around the bottom. And I'll do my other side. Sometimes they're a little tricky. So they're like little bumpers, so we can keep that applicator right in the area where we want to treat. Okay, so the next step is to put a gel liner on the area. This is so that we can protect the skin. So I'm going to open that up. And this part can be a little chilly for certain patients. So we're just going to drape this right over the area like that and make sure it's fitting properly. You want to be really careful to not tear the liner. Switch gloves. Okay, so the next step is to actually cover the gel liner with a clear sheet of plastic. This is to protect our applicator. So you just open this up and just drape this on top. Okay, and now Crystal is ready for us to place the CoolSmooth applicator on the area. So I'm going to come over here and get myself into position. So this CoolSmooth applicator actually comes with different Velcro straps that we use. That's how we're able to actually keep it adhered to the patient's leg. So what we're going to do is turn it this way. I'm going to place this in between the patient's legs so that the Velcro does not irritate or touch the skin. So this is a little bit like a puzzle. We just have to take our time and be very strategic of where we're placing the applicator. And once I get these Velcro pieces into place, then I'll go ahead and strap them down. So before I tighten everything down, I just want to make sure that the applicator is placed properly. Are you doing okay, Crystal? Is that uncomfortable?
No, not at all.
Okay. So now I just want to make sure everything is in the right position, and I'm going to tighten down my straps. I'll place a pillow underneath her leg just so she can feel a little more relaxed. And you can actually put your leg down. Okay. Are you pretty comfortable?
Yeah.
All right. So now I'm going to set the device. Okay, I've got her in position, so she is returning. And the area I've chosen is the outer thighs. You can treat multiple areas. We also use this CoolSmooth applicator in certain patients where we can treat over the abdominal area for patients that have had either tummy tuck or liposuction and they have just a little bit of fat that's remaining. This is a great applicator for patients that we were unable to treat before with our other CoolSculpting applicators that require suction. So I'm going to put it back here and you can also treat under this area as well. Okay. This is her first treatment to the outer thighs. We always recommend 2 treatments with any applicator, just so that we can reduce the fat as much as possible. We've never had to treat a patient more than twice in our practice. A lot of patients are very happy with the single treatment, such as Crystal, but for certain patients they do require 2 treatments. It depends upon the thickness of the fat. Okay. So we're going to confirm. And this is telling me that everything is ready, so I press my start button. And Crystal, you're going to actually start to feel a little bit of cold, that temperature dropping down. This one's a little different than the other treatment that we did, so there is no suction. You're just going to feel that temperature drop pretty rapidly. So for about maybe the next 5 to 10 minutes, it's going to get really, really cold. You'll feel maybe a little bit of a stinging or burning sensation. That's going to go away. That's just the cold affecting the area. And you'll sit with this applicator for 2 hours. So this is a 2-hour treatment with the CoolSmooth applicator as opposed to the other applicators which only require 1 hour. Once we actually apply the applicator, it depends on what they want to do. Sometimes they'll bring friends into the room, they can talk on the phone, they can check emails, they can take a nap.
It's a very relaxing experience. I mean, Tanya did a great job at making me all snug and tucked in. So she turned off the lights. It's like you're just laying in bed. You know, I was watching TV, texting some people. It's just a matter of staying entertained. I can even take a nap if I want to. I'm really comfortable right now.
I try to make it to where you feel like you're at home in your own bed. As you can see with Crystal, we were dual sculpting, which is typically how we treat every patient here if they're doing both left and right sides. The most common area for women is going to be the lower abdomen and also the flank, which is right over the waistline. And for men, it's also the waistline as well. We do some off-label treatments here in the office. We can treat the male chest. So for patients that do tend to have a little excess fat on the chest area, for men in particular, we can treat that as well with excellent results.
To be quite honest, at this point, they've been on for about an hour. I really don't feel anything. It's probably like a little cold sensation, nothing too bad. In the beginning, the first 5 minutes are a little rough. It feels really cold, like if you have a bag of ice on your skin. So you get like that little stinging sensation that you want to remove it, but it's nothing unbearable that isn't gonna hurt you. It's not painful, it's not like excruciating. It just feels a little weird, a little shocking at first. But right now I'm good. I don't feel anything.
I'm going to remove the straps and take the applicator off, remove the gel pad, remove the bumpers, and then massage the area for about 2 to 3 minutes. What you're going to feel is a intense sort of warming sensation. That could be a little uncomfortable, but again, it's sort of an introduction in the beginning, and then this is your exit kind of coming out of it. So within about 10 to 15 minutes, you'll be completely warm in that area. All right, so here we go. This is really easy to come off. It's a lot easier than putting it on. Okay. Just gonna take that. Okay, so actually this part is not so bad. The worst part is taking these little stickers off when they get stuck, but they usually come off pretty easy. Sorry. Tickles?
Yes.
Yeah. So if you can see the area that we marked here, so this was our area here. There was a little bit of a shift down, and that's going to be okay. Sometimes it will slide a little bit, but we just wanted to keep it in place in that general area. So now I'm just going to warm you up. Okay. Everything feel okay?
Yeah.
Okay, good. So this redness that you see is basically just from the applicator being so cold. It's very similar to when you put ice on the skin. That's going to happen as well. You'll notice in about maybe 5 to 10 minutes that that's all going to go away. There shouldn't be any bruising in this area. Okay, so we're completely done with our massage part for this side, so you're all finished. I'm gonna come to the other side once the timer's complete and we'll do the exact same thing. A lot of people will describe it where if you put your hand in a cooler to grab a drink, when you take your hand out, you're gonna have a little bit of stinging and a little discomfort, which basically lasts for about 5 to 10 minutes. You can go home, exercise, sauna, the beach, whatever it is that you want to do, travel if you're, going out of town that day. There's really no restrictions whatsoever with CoolSculpting, so this is a no downtime procedure. The beauty with CoolSculpting is that it's completely permanent, so it's not a treatment that you'll have to come back in several years and repeat all over again. It's also a great alternative for liposuction. It does not replace surgery, but for patients that are just not ready to have surgery or they might not be able to have surgery for medical purposes, CoolSculpting is an excellent alternative for them. The results are reducing the fat layer by 20 to 25%. Some patients can get more of a result, but typically most patients see a 20% reduction in the fat layer.
They just took the applicators off of me. She gave me my little massage on each of my thighs. It's feeling a little cold, but I have no pain, I have no discomfort. I'm ready to get dressed and walk out of here.